All right, we'll get started, and other folks may be joining. Heather, thank you so much for your willingness to do this webinar for us. Dr. Heather Darby from UVM Extension is speaking with us about the Cornell Soil Health Test, going to do kind of a deeper dive on what the test does and doesn't do, and do some work to sort of crosswalk that to make it really relevant to our discussions about designing a PES system, and some initial discussion of maybe what a pilot might look like if it were using the soil test. So Heather, if you have any sort of opening remarks, and we'll just turn it over to you.
Sure. Okay.
Thank you.
Great. Yeah, I think just following up, just that I've been asked to talk a bit more about the soil health test, and then again try to wrap it into the current conversations on payment for ecosystem services. And then in our discussion last week, we kind of ended up trying to, again, shape how the Cornell soil health test might be integrated into an actual payment for ecosystem service program. So just doing some brainstorming with the group's coordinators, we kind of came up with an idea that we're going to put by the group. So I'll just start. Let's see if I can get there we go. I think everybody is familiar with soil health or soil quality, and I believe that's really been at the heart of much of the discussion for the PES group, and it seems like everybody has sort of been able to come together around their desires to improve the health of the soils in Vermont, because we believe that if we have healthy soils, then we'll be able to achieve both the environmental outcomes that we're looking for, but also the kind of agricultural outcomes that we're looking for. So soil health itself is really kind of looking at the integration and also the optimization of the soil's biological, physical, and chemical processes. So I think everybody knows that we're not just looking at a standard soil chemical test, that we're actually evaluating the soil as a system more so now, and that we know if we look at the soil as a whole and try to optimize those parts of the soil, that will have better agricultural productivity, more sustained, more resilient, maybe not always better, and we'll also be achieving some of our environmental goals as well. So soil health has really been at the heart of many conversations today, especially as we are talking about climate change and building resiliency on farms, and also as we start to talk about improving environmental outputs from farms as well. So there have, in science, if you go to the scientific literature, you can actually find, thousands of scientific peer-reviewed journal articles that are focused on assessing the quality of the soil. The term soil health, I think, has, been used interchangeably, and it really does basically mean the same thing. But generally in the scientific literature, you're talking about overall soil quality. And as we've kind of rolled soil quality out into more the public facing regime, we've kind of transitioned our terminology over to healthy soil, like people could relate to that a little bit better. And on the kind of the forefront of that, really trying to bring this concept of soil quality and soil health to the people, to the farmers, and the other practitioners, and really to the public, Cornell really took the lead on that. Really trying to make soil health a conversation in the farming community. And, in order to make soil health feel a bit more real and tangible to people, they started to work on developing tests so that we could actually figure out if our soils were healthy. And I can remember, when I was getting my PhD at Oregon State, talking about soil quality, and people, if I would give a presentation at a farmer group meeting, they would be like, well, what does that mean exactly? And I would always say, well, you know when a soil is healthy, you know what it looks like and smells like and feels like, and you know the kind of crops it grows. So we know what healthy soil is, and the soil health test itself was developed to basically put some analytics to that so that people could gauge really just how healthy their soil was or maybe wasn't, so that they could make improvements mostly and management changes on their farm to try to achieve healthier soils. And again, through the sort of scientific world, people have linked different soil health or soil quality indicators to outcomes. So again, Cornell really took this out into the public. And again, what they were seeing, as well as many people, were degrading soils, reduced productivity on farms, and reduced profitability. And they were hoping if they could engage farmers and practitioners in this conversation of soil health and give them some tools to help them measure it, that it would lead to change in how we manage soils and look at them. And it indeed has really done that. And so again, the Cornell Soil Health Test, which is now called the Comprehensive Assessment for Soil Health, CASH, and I think maybe they just needed a really nifty, meaningful acronym, so that's why they changed the name. But so if you see in like the press or media, CASH, they're talking about the Cornell Soil Health Test. So again, this was made available to the public in 2006. And the research to develop this, kind of group of tests started back in, I think, 2000. And I personally became involved with Cornell on this project right when I started in 2003. So I've worked with the test and with Cornell scientists for, the past, 10, I guess 13 years, or more than that, because I think I started in 2003, trying to collect data, basically look at different practices and different indicators for soil health. So this has been a really long-term ongoing project, and it's very well supported in, both the public and private sectors and the research sector as probably really at this point the best analytical framework for testing for soil health. Now there are other kind of individual tests that can be used that are available through other labs or other frameworks, but really right now this is probably the best, longest standing, most comprehensive test that's available for the public and for farmers. So again, it was developed to address degrading soils and reduce productivity and profitability. And again, the whole point here was to emphasize the integration of soil, biological, physical, and chemical properties in the soil. So I don't probably have to tell this to this group, but prior to that, mostly, all of our tests were focused on chemical properties. And so this was really new and bringing this to the forefront to, the farming community in general. So Cornell has done a ton of work, again, to vet indicators. So what indicators can they measure in the lab that are then going to translate into soil function in the field? And so they've evaluated at this point about 42, that's a pretty exact number, and I'm sure they're looking at more potential soil health indicators. And they've selected a group of indicators, and those have been selected based on sensitivity to changes in soil management practices. So some indicators they're more long-term, I guess. So it's difficult to see changes, short-term changes in some soil health indicators. So one of the things that they were looking at, are there indicators that can show farmers changes in the short term and also the long term? So sensitivity to soil management practices. They also wanted indicators that both represented agronomically and environmentally important soil processes. So this isn't just focused on agronomics for the farm, but also indicators that have environmental relevancy and importance. Okay, other important factors for the Cornell Soil Health Test to adopt an indicator is consistency and reproducibility. So we have to remember that the majority of these tests are taken by people that are used to being in the field. They're not used to being in the lab. They're generally not scientists, and they're busy, and they're used to taking a soil test, a chemical soil test, which is relatively easy to do. You can certainly mess it up, of course, but you know, with very simple training, you're able to go out and you should be able to take a really good chemical soil test. And really that was the goal of the soil health program as well. We need to be able to provide indicators that are, you know, easy to take samples for. They're going to be able to provide consistent results. We're going to be able to reproduce those results. And then lastly, they're going to need to be cost effective, both in sampling time, but also laboratory costs. There are certainly a ton of, especially biological indicators that can be measured that may be, you know, more directly related to certain microbes per se, or even soil function. But the ability for people to take those samples, not just accurately, but handling them properly, getting them to the lab in a certain period of time. Some samples need to be put on, you know, dry ice or frozen in a -80 Celsius freezer immediately. You know, all those things are just not realistic for an everyday kind of soil test. So that was really important when Cornell was selecting indicators. And then lastly, being able to interpret what that means. We could have a really fancy test for soil biology that lists all these different types of microorganisms in the soil, but what does that mean, right? How do we interpret that to a farmer or other practitioner that needs to use the data? So again, these soil health indicators have been vetted and they have been modified over time as they figured out maybe cheaper ways to do the analysis or better ways to handle the samples. They have changed slightly, but again, Cornell has put a ton of time and their partners into vetting indicators that meet these requirements. And these requirements are really important for us to be able to collect data that's meaningful. Oh. So I think most everybody is probably familiar with the current soil health offerings through Cornell. And again, you can purchase the analysis separate. You can purchase it as a whole package. You can add on some indicators. But in general, this is what Cornell is offering through their soil health analysis. So you can see there's physical tests that are done on the soil, there's biological tests, and then there's chemical tests as well. So the physical tests are, you know, available water capacity, surface and subsurface hardness, and aggregate stability. Now, certainly there are more tests that could be offered, but these are the 4 that they have found to be cost effective, somewhat easy to sample for, and reproducible and meaningful out in the field to the practitioners. With the biological indicators, they have now settled on soil respiration and active carbon. And so again, these are indicators of biological activity. These have changed a little bit over time, You can also get some other indicators too. Some protein analysis is one. You can get potentially mineralizable nitrogen is another one. So again, they've settled on a suite of biological indicators that they have researched to be meaningful and easy to take. And then the chemical analysis, again, they have sort of the standard nutrient or chemical analysis that's used here in the East as well as other places. And then they have some add-on indicators too. So they have a suite, again, that they have vetted thoroughly, collected data on, and are made available now to the public. These are a couple of really old graphs, but you know, they haven't changed over time. I just mostly wanted to show people where different production systems kind of break down in the Cornell Soil Health Test framework. And so back in the mid-2000s, I worked with Cornell to go around and collect data from a variety of production systems in Vermont, and a number of other people did as well. And we kind of pooled that data to see, you know, what do different systems look like on the soil health scale. And so I thought I would just show this to folks. These are vegetable farms, or people that were growing vegetables, or fields that were sampled under vegetable production. These are commercial farms, so it doesn't take into account maybe homeowners or homesteaders that are using the test. And you can see the red bars represent low soil health, green represents high soil health, and then yellow is in the middle. And these are the percent of fields that scored, you know, low, medium, or high for each one of the soil health indicators. And you can see for vegetable production, again, this is commercial vegetable production. You can see that there's certainly a lot of red here, especially in the physical and biological constraints. So there was poor, you know, higher levels of low soil quality for physical constraints and biological constraints on the vegetable farms. And you can see in terms of chemical analysis that most farms were doing very well there. And that makes sense, right? Because over time, all we've really focused on for most of our farms is the chemical analysis, how to grow crops by giving them the right amount of nutrients. So we've gotten really good at that. So you can see with effort and focus, we've been able to make sure that people add the right amount of nutrients to grow their crops. And where we focused over the past now 10 years, and probably most intensively over the last 5 years, is on these other factors. So, you know, that's really what we're talking about in Vermont, that we've probably done a pretty good job over here, but what we really want people to do is focus on both the biological and the physical properties and try to move all of these into soils that have high quality in physical, biological, and chemical properties. Here's field crops. So these would just be grain producers, essentially, just people growing like corn or soybeans. And again, you can see this is a little bit more of a mixed bag where we have green popping up, you know, in the chemical side of things, but still a lot of kind of low or medium testing chemical properties. The biology is a little bit all over the board, and the physical properties seem to be the most constrained. And if you think about this, vegetable crops versus field crops, vegetable crops tend to be higher value, and people tend to be able to maybe invest more money, maybe in compost or other fertility amendments, where field crops tend to be lower value, and people may be scrimping a bit to make ends meet, especially on the chemical side of things. Now, if we look at dairy systems, you can see with dairy, we're doing pretty well, again, with the chemical aspect of the soil. Surprisingly, really the biology isn't too bad as well. You can see a lot of people have high organic matter fields, high levels of mineralizable nitrogen. The root health seems to be good. The active carbons, not so great. And then if you go over to the physical properties, you can see this is actually where dairy systems seem to have the most constraints. And that probably makes sense to folks if you think about equipment used probably primarily to spread manure, impacting the overall maybe physical properties of the soil. You can see that the aggregate stability on dairy farms was really high for the most part. And again, if you think about a dairy system in general, there's manure. So there's a good source of organic matter being added to the fields, which increases biological activity, increases the nutrient profile, and can also increase the aggregation in the soil. But the addition of that manure may be of detriment to the other physical properties in the soil and the equipment that may be run across those fields. So one of the reasons I'm showing these slides as well is to really think about the assumption that I think many people have that soil health is poor in Vermont, okay? We're focused on soil health maybe because we think that it's so poor that if we improve it on our farms, we're going to achieve certain outcomes, you know, an outcome of clean water. And I just want you to question your assumptions a little bit because we don't really have a full kind of comprehensive view of soil health in Vermont. Again, I worked with Cornell and others did too. I know Jeff Carter's on here. He submitted a lot of samples to Cornell. I have, and other folks as well. But you can see in general, we may not be doing that bad in regards to our dairy systems. It's hard to say how the vegetable systems look in Vermont. Maybe they're this constrained. If we just looked at those systems, maybe not. But we're guessing, really. We don't really know with certainty the lay of the land and what soil health looks like across agricultural production systems in Vermont. So we're basically assuming that it's poor and that people need to improve it, which is likely true in some cases, and that if we improve soil health, then we're going to improve the outcomes that we want to achieve. And the primary one in this case being clean water. I think that's kind of what everyone's focus has been. But again, we don't know really what the landscape looks like in terms of soil health. And I think we can probably work with Cornell. So they started pulling apart statewide data, regional data a couple years ago to try to figure out some answers to various questions they've had. And so Joseph at Cornell sent me this data last winter that he had been working on, looking at organic matter levels in the Northeast. And so he sent me the Vermont data, and he sent me Pennsylvania and New York, and I think he also had Michigan in there, and I can't remember a few other states. And it's not to say that we shouldn't do better and we should keep trying, but again, my point being that it's always good to know where we're starting from before we invest a ton of resources into something that we may turn around a year from now and say, well, you know, really the soil health on these farms was pretty good. That wasn't really the issue. It was this. So I just thought I would throw that out, that we are making an assumption that soil health needs to be improved without knowing where we're starting from as well. And you can see overall, Vermont organic matter levels tend to be higher than the Pennsylvania and New York farms. And again, these are just farms that have submitted soil health samples. But the response I got back from Joseph was, well, we're not comparing apples to apples. Vermont farms have a lot of perennial forages, so their organic matter levels are higher. Well, again, we're talking about, if we're just looking at Vermont and soil health within Vermont, we may be making, you know, again, we need to question our assumption that soil health is just bad, because I think most of us know that that's likely not true, and it might behoove us to kind of figure out what soil health looks like in Vermont before we go on a campaign to, you know, think that we're going to drastically improve it. Okay. And that's just maybe a sidebar for us to think about. And I think Ryan's on this call as well, or on this presentation. And I think definitely we could work with Cornell to get our data for Vermont maybe, and be able to take a look at that, at least to get a sense of, you know, where we may need to make improvements, but where maybe we may not. Okay, so again, the Cornell Soil Health Test, it's a test, right? It's an analysis, it's an analytical procedure, it's done in the lab, and it's really measuring biological, physical, and chemical properties of the soil that we believe are indicators of a highly functioning soil. So if these analytics come back positive, and good, let's say, per se, then our assumption is that we have a high functioning soil, both agronomically and environmentally, right? It's a practical tool, so that's the other piece. It's used to make management decisions currently. It's used to monitor changes in soil health conditions over time, okay? It's not currently being used, I don't think anyway, as a way to, you know, make payments to farms. So this is really a practical tool that farmers can use and other stakeholders for management decisions, and then to also monitor how those management decisions might influence farm management. Yes.
Heather, a question just came in from Jill, and she says, what would you recommend as an approach to gather adequate data to gain a better baseline understanding of Vermont soil health?
Yeah, so I think probably where we should start is just working with Cornell with the data that they have. They have quite a bit of data from Vermont, and that just might be the very first step to understanding if they're able to actually share that in some form. I think that would be a really good start, you know, and that would be something that really has already been paid for, right? And they have been analyzing the different states, so they may be able to share that with us right from the get-go. So that would be my first suggestion.
Yeah, Jill, I just made it so you could talk. Jill, does that answer your question, or did you have a follow-up? I will take your silence to mean that.
Okay.
But feel free to jump in at any point, Jill.
All right, so again, it's an analytical test done in a lab, and it takes measurements of specific factors in the soil, and then we're translating those basically to mean that if these indicators come up good or high, then we have a well-functioning soil, okay? So I just wanted to now move into more, I guess, of the conversation of maybe how would we use the soil health test. We already talked about what it does. Now we're going to kind of delve into what it doesn't do, and then start thinking about how it might be used in this kind of PES conversation or pilot. So I'll end on this slide saying that you know, one of the components of the soil health test indicators and their success is making sure that we have, you know, easy and consistent sampling procedures. And those have been developed or Cornell has developed those for the soil health test. So it does have a set of best practices for sampling. Now, again, most of these samples and analysis are used by practitioners. So just like we say with a chemical test, you know, the best thing is to be consistent about when you take those samples. And then we have a very, you know, sort of practical and straightforward way that we tell people how to sample the fields. And if they follow that and they are consistent in their process and timing, then they should be able to compare results over time and feel good about doing that. And it's the same way with Cornell soil health tests. They're basically saying, you know, here's the best time to sample the soils. This is how they need to be sampled and handled and sent to the lab. And then a farmer can be monitoring the health of their soil over time or year to year and looking for changes. Okay, so that's a very important part of the process to having something that you can work with. So again, these kind of specific protocols, I'm not going to go into this, but they do exist and they're important. Okay, and how you take the samples, all of that is very important to having those results that you can look at that are meaningful, and then, you know, you're able to use those over time. Okay, so I think most people know that once you go through the process of taking the sample and sending it in, you're going to get your results back. And there are scoring functions that are used in today's soil health test that's available. You can get a score of high, medium, or low. And if you think about this, it says 70 to 90, but that actually should be to 100. You can score 100. But you're going to score high in any given indicator if you get a score of 70 to 100. Okay, and that 70 to 100 basically is very similar to a chemical test. It translates into a, here's just an example of an active carbon range that was seen in the soil test report. So it's just like taking a chemical test and getting back those interpretations. So if you take a chemical test and the chemical test measures, you know, 4 parts per million of phosphorus, that gets interpreted into a score, basically, in a chemical test of, you know, very low, low, medium, optimum, or very high. And this essentially is basically the same concept. If you get an active carbon result in your soil of 600, then that translates into a high score, and high is between, you know, 60 and 80. So it's using those same basic kind of interpretation models as a chemical test. And so it's using a, you know, cumulative normal distribution of all the data for scoring. And if you're really interested in the nitty-gritty of how they've developed their scoring rubric, they have an entire manual that goes through this process over, you know, about 30 pages of information. But I think most people can relate to the kind of standard soil test model that's used. The piece that is a little bit different for the Cornell scores, for the soil health scores, is that the scores are in these distributions based on the soil type. Okay, so that's really important. And I know anybody on this call that's worked with farmers would say, well, I have a clay soil, and my clay soil isn't going to act like a sandy soil. And that's absolutely true. And Cornell has taken that into consideration when they give the results. That's part of the reason that they measure soil texture as part of the whole soil health package. Elizabeth, is there another question?
Actually, I had one, which is just that I have a feeling the discussion of sort of crosswalking this over to a potential pilot is going to be rich, and so I just want to make sure we leave time for that.
We're almost there.
Okay, great.
Yep. Okay, so again, if you get a low score, it means that you have constraints on productivity. And so most everybody has seen this test results. And you can see when you get a low score, which is indicated by red, and this is an old one in their manual, that means that if you improved aggregate stability and you alleviated this constraint, your soil would be more highly functioning, okay? And so if you get these lower scores, then making a change will likely result in some improvement in productivity or environmental quality. But this is where it's a bit different than the chemical tests, where we usually say, oh, you're going to get higher yields if you provide the nutrients that the plant needs. These aren't quite as direct in their outcomes, okay? And that's an important part of the conversation we need to have. So you can see here, this soil scored a 59. So it's in the medium category, and it would need to be improved. And if it was, then likely the soil would become more productive agronomically and environmentally. Okay, so some of the questions we need to think about if this was going to be used in a PES model. I think the big ones are, the simple ones more so than the big ones. Who takes the samples and when are the samples taken? So again, this reproducibility that I talked about, these are minor things that need to be addressed. Some of the more major components would be what score allows for a payment. In my own personal opinion, we already pay people to overcome these resource concerns or these constraints, right? So we already have programs like EQIP and BMP state funds that are there to help people really improve soil quality, like cover cropping and no-till, different manure management practices, crop rotation. So we already have funds in place to help people make improvements. So really the conversation should be around, when do we think the soil is healthy enough that we're achieving, the outcomes that we want? And so what score is that? Does it have to be high in every category for us to make a payment? And if they're not, then they're basically accessing other funds to be able to get there, okay? So the tougher question is, what score allows for a payment? And this is where we have to delve into the challenges, what the soil health test does not do, right? So the soil health test is not a direct measurement of our desirable end goal that I think right now is water quality. I put a question mark because it could be other things in the PS conversation. But high soil health does not always mean good water quality coming off from a farm, okay, or any landscape. It definitely should help, but we're not measuring that. We're measuring soil health indicators. We're not measuring water quality indicators necessarily, okay? So that's something we have to think about. Is this good enough? Right? Is a score of 90 on the soil health test giving us some comfort knowing that if the soil quality is high or the soil health is high, then water quality will be better, okay? So that's one big question. The other limitation of soil health testing is it doesn't actually capture all the other items or landscape pieces that may impact water quality. And there's a lot of them, right? We already know this. Manure application rate, timing, buffers, tile. There's lots of factors outside of soil health and soil health measurements that can influence a farm's impact on water. Okay, so again, something we need to think about. So what score leads to a payment for PES? And I just kind of mentioned this. Personally, I think farmers should have to score green in all of the categories and all the indicators to be able to maybe assume that our water quality outcomes are being met. And that anybody who's not doing that, there are programs already in place, and those programs would need to stay in place to help farmers achieve that score of 90, let's say. I just put that out there. I think it's actually a 70 for all indicators to be in the green. But so we have to decide what is that acceptable score? And then we have to make sure that the other programs are still in place so that farmers that aren't there are able to make it there, okay? So then the other question comes, well, what about everything else? What about all the other things that the soil health analysis isn't thinking about? So I put down here, what other tools might be combined with this to kind of close that loop? So we're measuring soil health indicators, but we don't really know, maybe there's gully erosion, maybe there's just some concentrated flow, I guess that would be gully erosion or rill erosion. Maybe their manure application, they're putting a lot of manure on, so they have high biological properties, and they're doing that with small equipment, so the physical properties are fine, but they're spreading too close to the water, let's say. So I think, the first piece that I would just point to, if we are going to use cash, that the RAPs, just using those as a base for the whole program would be really important, because the RAPs really should cover those other landscape factors, the buffer size, the amount of manure applied, through a nutrient management plan. That really should kind of maybe meet those other missing pieces from a soil health test. In addition to that, other tools that could be used would be some of our, I call them water quality models for lack of a better term, but this might be where a model like Farm Prep or RSET comes into play, okay? But again, it really depends how complicated we want to make this, how many moving parts, how many things to look at and evaluate do we want in the whole picture, okay? The RAPs are already in place, and the Cornell soil health system also is already in place. It's already been verified. It's got over 20 years of data incorporated into the analytical interpretations. So I think that tool has, it's vetted. It's a good tool. We know that. Some of the water quality models, not to say that they're not good tools, but they need a lot of data, or maybe they don't have a lot of local data in them yet. And there's always a lot of question about using some of the models that are available and what kind of output we're going to get. Okay, so here's some considerations to think about if we want to use the Cornell soil health test in the PES system. Okay, so this kind of led me down a road of verifying in Vermont the Cornell soil health test. And what I mean by that is, and maybe this is, kind of where Jill was going to, if this is taxpayer dollars, and there's also a lot of people involved in this conversation that really want to see the outcome, which is clean water in this case. And if we go down the road of using the Cornell soil health test, okay, with the RAPs, and we don't achieve those outcomes, we're not going to be very happy about that. So how do we verify that if a soil has a score, let's say of 90, that it does have an impact on the quality of the water coming off of that field or farm, right? So somewhere along the way, I think it's in our best interest to use a pilot to verify what the outcomes of cash are in regards to water quality or other ecosystem services we might be thinking about, okay? And through that, we have to come up with this, kind of, we have to draw a line in the sand, basically, because obviously there are going to be cases where we have a soil health test score of 90, but we're not achieving the desired outcomes 100%. So we have to decide that, let's say 75% of the time, if a field has a soil health test score of 90, we achieve our desirable outcomes. And people agree that that's good. Okay, that's a good investment in taxpayer dollars and using this soil health test. So again, these are considerations as we build a program. So here's my proposed pilot, and I know this is what I'm supposed to get to. So I agree that using the Cornell soil health test is a good starting point. And I agree that the Cornell soil health test results combined with implementation of the RAPs will help sort of cover, I believe, most of the landscape that we need to be looking at. But what we really need to do is sort of verify what we're going to get with that. What's going to be the outcomes of using the soil health test with a score that we select, or some range of scores, okay, in addition to the RAPs. What are the actual outcomes? So I would propose that we start by, finding fields or selecting fields with varying soil health test results, okay? So this would be from a range of operations throughout the state of Vermont: locations, soil types, slopes, production systems. And then we use in-field monitoring and measurements to verify what we're achieving, okay, by using the soil health test results as our primary tool to pay for PES. I think this is really critical. And there are lots of different, well, maybe not lots, there are probably a few different individuals, companies, private, industry that can do this in-field monitoring and measurement so that we can, again, verify the desired outcomes, okay, and then be able to relate those back to the soil health test results. I don't think we want to get years down the road just using the Cornell soil health test without this, verification piece. And personally, I feel like this is where we need to start. It's not a built-out proposed pilot, but I think this is something that we could probably start on, right away this coming season. And again, looking towards Cornell for the baseline data that they have, just to even get us started. That would help us actually select, field types that we may want to look at. And then we have to decide how many fields we actually monitor and measure. But I think this is a good place to start. And again, this is my own opinion, but Patrick and Elizabeth said we should just put this out there so we have something to chew on. So
no, and I think thank you for being willing to put it out there and giving us something to chew on. And Jeff and Jill and Ryan, I just made it all possible for you to talk. I figured since we're a smaller group, we can just have a discussion. So if you unmute yourself, you can just share, or if you prefer, you can always put something in the chat. But thank you so much, Heather. This is really helpful, and thanks for getting us to this point and putting these important questions on the table.
Yeah, the one thing I didn't, oh, go ahead, Brian.
Sorry, Heather, this is Ryan. My microphone's moving. I think you guys can hear me. I just want to say thank you for sharing the background and your proposal. It's really great to get these ideas on the table, and just want to say thanks for taking the time to do that.
Yeah, I would just quickly add that I put modeling efforts in here because I think the in-field monitoring and measurements is going to be a really good way to also beef up the models that we have so that we can use those better into the future to also help farmers target management to make it to that level where they can get paid. So
yeah, thank you. Jill, go ahead.
Sure, yeah, a couple of comments. Hi, Heather, thank you. It's very interesting. So I did want to note that the Vermont Environmental Stewardship Program has been taking Cornell soil tests on those farms and collecting that data and using it in combination with RSET. And then, of course, another obvious measure, I just have this sort of formula framing out in my brain, like RAP compliance, soil health, RSET, and the other one is T, tolerable soil loss. And we just say, what's the formula that we're going to build to sort of combine a variety of indicators of expected improved water quality. Yeah, I think that I'd be really interested in, Heather, in looking at that, having someone look at, not that I have the expertise, look at the Cornell data and figure out what's missing and look at what we have with VESP, and is there something missing, and would we be basically sort of beefing up what we've already been doing sort of ad hoc, and how would we sort of lay that out as a possible part of the pilot part of the pilot process. And it'd be great if we could do some of that right away so that we could start mapping out what that study might look like. Do we just need more, more tests taken? Is Cornell willing to do the work? That kind of thing. And then my last point, so that might be something we could work into our report. And my last point, you're talking about in-field monitoring. So as a verification tool, rather than a tool every farmer is going to use. And I feel a little better about that just because it's costly. We heard from John in our last webinar, that basically they pick a number and they're making an assumption that there's a water quality benefit without any verification of the water quality benefit other than the models that they've been using all along. I mean, they're
Right.
robust models, but they're not localized or just localized. And I feel a little more comfortable with, supporting funding for in-field monitoring, knowing that it would have a wider use and it's a fabulous tool for the farmer to track their own soil health just because it feels cost prohibitive to me. So those are some of my thoughts.
Yeah, I mean, I don't think we can go too far. I mean, we shouldn't be going very far with any, whether it's a model or the soil health test or whatever, without having that kind of in-field verification, because I think we want to be able to say with confidence, we've selected these tools, and maybe it just ends up being somebody's following the RAPs, which we're supposed to be doing anyway. And then we take the soil health test, this person takes it this time of the year. And if they score 90, then, based on our in-field monitoring and measurements, we know that if they score 90%, that the percent of the chance of the desired outcome in our actual monitoring was always 80% or better. I mean, then we can say that versus just saying, well, we're using the Cornell soil health test because that's what's available. If it's available, but it's not going to achieve what we want, even with the VSP program, then, it's not the best tool to use, even though it's there. So I think those are or we might just find that the best pieces we need are 3 components of the soil health test. And it costs us, $60 a year to do it versus, thousands and thousands of dollars. So I think that's really the key to the pilot, is that the verification of what we want to use, which is right now the Cornell soil health test.
Hey, Heather.
Yeah.
So we're going to ask, Kirsten's with me here too.
Yeah.
So what is the in-field monitoring that we would do to then verify the soil health test in that particular field, and at the same time run a model like
Yeah.
the one that they're proposing here? So what is that in-field monitoring? Is that an edge of field site?
Yeah, I mean, I guess I was thinking of lots of different components, right? So this is the expensive part, but we're assuming that we're going to pick very select places to do this, and that the measurements would be quite extensive, right? So there would probably be a component of in-field physical measurements. So like we've heard a lot about the double head infiltrometer, right? We've heard a lot about edge of field monitoring and so on and so forth. So, you know, we might have to put lysimeters out in the fields. You know, I guess it really depends. What are the water quality outcomes that people want to achieve? You know, and if the taxpayers decide that, well, just knowing that everybody has an organic matter level of 5% is good enough for us, then why would we spend a bunch of money on everything else? You know, it's just like, we got to connect the soil health test, I think, I'm assuming, to, you know, those outcomes. What is it that people really want to see happen? You know, because I keep hearing people saying, oh, we want regenerative ag, which I'm not sure if people know what that really means to them. And if it's just like building carbon in the soil, well, sure, we can measure that easier than almost anything. But is that really what they want? So I think it's going to be depend on whatever this group or the next group figures out to be, you know, what is that outcome? Is it no phosphorus moving off the fields or limited? I don't know.
I think, Heather, I think we're still looking at big picture. And when you take the Cornell soil health test and boil it down to a number,
Yep.
there's so many factors in there.
Oh, yeah.
It's not very useful. I do see things like soil aggregation.
Yep.
There's a measure that could be, and Juan did it this morning. I don't know if you watched the extension show this morning, but he related organic matter to water holding capacity to right to the flooding issue. So I don't think this work group knows what they want for a metric. It's hung up on phosphorus because that's the state.
Right.
But should there be different pieces? One's just phosphorus in the lake or nitrogen. One is carbon. One is flooding resiliency because of soil aggregate, you know. So to me, I like the Cornell soil health test, but it wraps too much up into one piece.
Well, right. I mean, it's supposed to be comprehensive, right? So that's, right. They're trying to sell like basically all the indicators that should, you know, if you kind of master these, you're going to achieve a high functioning soil. But what is a high functioning soil? What's the outcome of that, right?
And we may want to mention too that NRCS at the national level has adopted the CASH test as their methodology for soil health for the big research projects that are going
right.
So it is the right tool.
Right. And I guess part of my in-field monitoring and measurements, you know, I'm thinking about all the conversations we've had, you know, with Landstream, with nutrient, with stone, with extension, right? I mean, there's lots of opportunities there based on what you know, different people are saying, you know, are the best ways for us to capture outcomes. You know, how do we select basically from that to do some real in-field measurements? And I'm not opposed to doing these on every farm. I just don't see that being, you know, maybe I just don't see where we'd have to have money just to do that, which then may end up not leaving any money to pay for the outcome. That would be my biggest concern, you know, unless these things were made super cheap, which the CASH, you know, the soil health test in comparison to everything else that we're talking about is pretty cheap. But we don't really know what it achieves.
Super good point and interesting. And I just want to see if there's maybe one more question we want to have, and then we'll wrap this up just to keep it within the time. But this is a really useful discussion. Jill, Ryan, or Jeff, any other questions you want to ask Heather? And this will probably not be our only conversation with her, but for the moment.
You know, well, you guys are supposed to ask questions, but I was just going to say, you know, last week, my conversation with Indigo Ag, you know, they ramped up their staff by 1,000 people in the last year. And they're out collecting carbon samples all over the country because they, you know, people want to pay for that, you know. And I mean, to me, that was just an amazing testament to, you know, the private piece that we've been talking about as well. But they're verifying the carbon on the ground. They've hired all these people to go do it. And then they're selling commodities, you know, at a higher price with those numbers in hand.
Right. Says something really interesting about where the sort of private market will drive some of these metrics and what we decide to value. Well, Heather, really, really appreciate your putting together this presentation and your willingness to sort of walk out to help us frame these important questions that we need to figure out over the course of this working group's deliberations. Thank you so much. We'll be recording this and we'll post it on the PES working group website as soon as possible. Thank you all for coming. Thank you so much.
Thanks. Bye.
Thanks, Heather.